All right. Well, hello everyone. Happy Friday. Hope everybody's having an awesome day. All right, so I am here to answer questions. It's been a while. Been pretty busy doing a number of interviews for my podcast and being on other podcasts. And Friday's one of those days I do it. But anyway, was able to do this Q&A here and also for the first time live streaming. So I'm live streaming to my Facebook page, my YouTube channel, which I have been doing, but for the first time I'm live streaming to Instagram. So hopefully that's going okay. At least I'm attempting to live stream to Instagram. All right, so let's go ahead and go over a few resources here. So hopefully you've checked out my podcast. If you have not, you could do so by visiting savemythyroid.com and just clicking on podcasts, or visiting your favorite podcast platform and typing in Save My Thyroid. And so with the podcast, there's a little bit more focus on hyperthyroidism, but most of the episodes will benefit those with either hyperthyroidism or Hashimoto. So you'll see there's Tuesdays, there's a mixture of either interviews or what I call Say My Thyroid health audits, where I speak with someone dealing with a thyroid, autoimmune thyroid condition. And then sometimes there'll be a solo episode. And then on Thursdays, pretty much it's solo. It's a Q&A episode, just myself. And let's see. And also, if you're not familiar with my main website, so savemythyroid.com, I launched in 2021 when I released my podcast, but naturalendocrinesolutions.com has been around for now about 15 years. So 2010 is when naturalendocrinesolutions.com was born, and that has hundreds of articles, blog posts related to hyperthyroidism, Graves' disease, Hashimoto's as well. Also have a supplement line, which you can check out by visiting thyroidsave.com. Some books as well. So books, Natural Treatment Solutions for Hyperthyroidism, Graves' disease, 3rd edition, came out in late 2023. Hashimoto's Triggers, I released that in 2018. And then the Hyperthyroid Healing Diet came out last year, 2024. And then, yeah, if you want to check me out on YouTube, you could visit, which some of you are tuning in from YouTube, savemythyroid.com/YouTube. And then savemythyroid.com/quiz. And then also I just released a newsletter, which you could check out by, let's see, hopefully it's not cut off here. Here we go. savemythyroid.com/newsletter is my Healthy Gut, Healthy Thyroid newsletter. And that is it. So if there are questions, definitely let me know. And it looks like there are some questions. All right. Anshad, you are welcome for the live session. Thank you for tuning in. With Instagram, so I'm using StreamYard to stream to the platforms, but with Instagram, I believe I have to actually go to Instagram to see if there are any questions. With YouTube and Facebook, the comments actually come through StreamYard. So, all right, let's see. So we have a question. Some Nika says, December 2024, I had free T3 of 4.99, free T4 of 19.2, and TSH less than 0.005. Now in February, my free T4 falls to 12.3, but TSH is 0.34. Does this mean I'm falling back to hypo? What could be the reason? How should I adjust bugle weed to closer to optimals again? I'm taking 20 drops of tincture out of 15, recommended 3 times a day. Not sure about the potency, so maybe I'm over medicated. And how do I know I can completely stop taking bugle weed once I fit the optimal range? So, I mean, I can't tell you specifically what to do. I can only give like specifics to patients. I will say that, yeah, it does look like you're becoming hypo, like with the potentially. I mean, your TSH is still low, but it's at least heading in the hypo direction. And it does make sense to reduce the dose of bugleweed based on this. I have a podcast episode like how much bugleweed should I take, where I talk about dosing, but yeah, I mean, with these numbers, it would seem to make sense to do that. But as far as what can be the reason, I mean, potentially the bugleweed, but could also be that you have antibodies for Graves and Hashimoto's. Some people who have, again, I don't know anything about your history, but some people have subacute thyroiditis where they're hyperthyroid for a short period of time, like a few months, and then they slowly become hypo, and usually they normalize as well. And then how do I know I can completely stop taking bugleweed once I fit the optimal range? I mean, so when I dealt with Graves' disease, so I took I took the bugleweed. I took a teaspoon twice per day of mid-year bugleweed, and as the numbers improved, and then like once I started going hypo, I and I wasn't like crazy hypo, but like when the TSH was heading in the hypo direction, I cut the dose to like half a teaspoon twice per day, and then eventually 1 teaspoon twice per day. I'm sorry, half a teaspoon once per day, and then even half a teaspoon every other day. So it was a gradual process. But that was so like when I cut it the first time, half teaspoon twice per day, I would wait until I did another thyroid panel. And then when I was still a little bit more on the hypo side, then I would reduce it. If someone's not on the hypo side after reducing the dose, they might have to stay on that dose for a little bit. All right. So Mama Boy says, can Hashimoto's turn you from hypothyroid to hyperthyroid? I also have nodules and a cyst on the thyroid. So Hashimoto's you could have, there's a few different things that could be going on. I mean, you could have Hashitoxicosis, where you could fluctuate between hypothyroidism and hyperthyroidism, or you could have the antibodies for both Hashimoto's and Graves' disease. And if that's the case, if you have the antibodies for both Hashimoto's and Graves, you could start out as hypo and then switch to hyper, or vice versa. Some people start out as hyper and then switch to hypo. But yeah, so either one of those scenarios. I mean, some people also have like toxic nodules, which can produce hyperthyroidism. So that's a possibility as well. Okay, so Anshad, my wife diagnosed with Graves recently. As let's see, so 1/6. Okay, so January 6, 2025. Her TSH 0.01, free T3 5.39, free T4 2.18. So did the thyroid scan 15th of January. Graves was suggested. Took the antithyroid medication 10 milligrams for 30 days. Okay, so I'm not sure what you questioned. So 10 milligrams twice a day, I guess so, because 101 for 30 days. So I guess maybe your question's coming, but let's see. Well, so we'll get back to see if you have a question related to that. Yeah, okay. You keep on sending different. So I'll wait, I guess, until you have a question. So Nika also asked, what are the optimals for thyroid hormones and TSH when trying to conceive? My antibodies will be tested in 2 weeks, so not sure about these so far, even if I know that's the most important one. Thank you. Yeah, I mean, the antibodies, you could conceive with the antibodies. It increases the risk of miscarriage, but it doesn't mean that you will have a miscarriage. TSH, I like to see between 1 and 1.5, I would say optimally for conception. Free T4, these are United States measures, so different than some of the people put on this in the comments here. But free T4 between also, like I'd say 1 and 1.5, free T3 between 3 and 3.5. And then you often mention some specific natural treatment like avoiding gluten or dairy in connection with the most autoimmune diseases. Can the paleo diet be beneficial for rheumatoid arthritis? Yeah, paleo or AIP, autoimmune paleo is for all autoimmune conditions, not just rheumatoid arthritis. But if someone finds AIP to be restrictive, then they could just do a regular paleo diet, and hopefully that will still be, I mean, it's still a pretty healthy diet. And then can we say L-carnitine is a real fat burner? I'm considering to take it due to high antibodies, but I cannot afford to lose more. I mean, I've had a lot of, I mean, it does help with fatty acid oxidation. I wouldn't really say it's a fat burner, but um, again, I didn't take like I lost a lot of weight when I dealt with Graves, but I didn't take L-carnitine. I've had others take L-carnitine, and it doesn't seem like it accelerates the weight loss. But keep in mind, not everybody needs to take L-carnitine. Like I said, I didn't take it when I dealt with Graves' disease. Okay, so let's get back to Anshad. So Anshad, so again, wife diagnosed with Graves recently, and then these were her numbers. Recently in January, and was taking 10 milligrams twice per day for 30 days. And as of March 6th, yeah, TSH 32, pretty high. So yeah, so now doctor is saying that it's hypothyroidism. And yeah, I mean, it's hypothyroidism because she's probably taken too much of the antithyroid medication. So, new to YouTube live stream. Okay, no worries. Okay, so now we're confused. Doctor suggested either going with radioactive iodine. One doctor starts to go with medication for 18 months. Yeah. I mean, it's ultimately up to you. I'd be very hesitant to jump into the medication. And again, if you were taking even 10 milligrams once a day, some people will become hypo. So if someone, let's say, and it looks like you're taking 10 milligrams twice a day, but let's say someone's taking 10 milligrams of antithyroid medication twice per day, and then the numbers come back as hypo. To me, it's crazy to say, oh, let's just jump to the radioactive iodine. To me, that's just saying it's too much. So if someone's taking 10 milligrams twice per day, then maybe they only need, I mean, again, I can't tell you what to take, but like you could ask the doctor to put you on half the dose. But if you're taking 10 milligrams twice per day and then you drop it to 5 milligrams twice a day, that still might be too much. I mean, you could ask to have her be put on 5 milligrams once a day and see what the numbers. So sometimes it can be sometimes challenging to get the dosage right, but it sounds like she was just on too high of a dose. And so, I mean, the medication, yeah, they'll typically put people on the antithyroid medication for 18 to 24 months. So, especially if you're not addressing the cause of the problem, which is what this is all about, what I'm all about. Okay, so I'm going to try to get to as many questions as I can, but I want to get to everybody at least once. So, so we haven't gotten to Griffin yet, and Griffin says, so I have created a table to compare lab values. I'm looking at the variance of the changes from one test to the next. My TSH was less than 0.005. Now it's less than 0.01. I'm thinking I'm improving. 3 months out, all natural and supplements. Free T4 2.84, free T3 6.71 to continue drug free. Romania may add. I mean that's up to you. You could. I mean, I guess the question is if you're taking anything specifically to lower thyroid hormones, like if you're taking bugleweed. Bugleweed is what I took to help to lower the thyroid hormones. So I'm not sure exactly what you're taking to help with that. And then, of course, if I don't know if you have Graves, but either way, you want to address the cause of the problem. So even if like you had Graves and you were taking things like bugleweed. I mean, Romania, I usually don't just say like to people, I mean, I do recommend basic, like I give general supplement recommendations like an omega-3 fatty acid or probiotic, but I also like to do testing to try to find triggers and underlying imbalances. Vitamin D, do like test for vitamin D. So antibodies high. and yes, taking bugleweed and motherwort. Um, so which is good. So that's good. But as far as I mean, the dosing could play a role, like bugleweed, like as far as lowering thyroid hormone levels. Some people aren't taking enough of the bugleweed. Some people might need to add something like L-carnitine to the bugleweed. And okay, good. You've been doing all my suggestions. Yeah. I don't. Do you have my books? Because also in the books, I go into greater detail and more specifics as well. That, as you know, in the books, I talk a decent amount about testing. I try not to go crazy with the functional medicine testing, but I do like to try to get as many answers as someone could get. And maybe lithium. I mean, so we got, for lowering thyroid hormones naturally, we got bugleweed, L-carnitine in higher doses, and then lithium orotate. And it sounds like you do have my books. Thank you for purchasing the book. So yeah, if someone's like taking a bugleweed 1 to 2 extract, let's say 5 milliliters twice per day, and the numbers still are maybe looking better but still hyper, then adding either L-carnitine, and again, the research shows between 2 and 4,000 milligrams per day of L-carnitine tartrate. And then lithium orotate, typically it's like 5 milligrams, like 2 or 3 times a day. So that is something that in some cases can help. So, okay. Anshad, Sparky, I'll get to you in just a minute. Anshad just says, how can I get in touch with you for a personal consultation? We don't want to continue with medication like that. It's affecting daily life. So I would, so there's a few options you could, let me see. I'm trying to bring, of course, up. So visit, what I would say, since it's a weekend, you could visit my staff person, Kate. Her email is staff, STAFF, at naturalendocrinesolutions.com. But she's off on Friday, so she won't get back to you until Monday. But you could definitely do that. You could also call the office. But workwithdreric.com will give you some guidance as far as the next steps if you do want to work with me. And definitely not taking that much bugleweed. Thank you. Yeah, a lot of people, what they do, especially if they're taking like Herb Farm is available, so and it gives like dropper fill, so they're doing like one dropper fill, like maybe they might do it 3 or 4 times a day, but a dropper fill might only be like 1 milliliter, and then the potency of that is like 1 to 5. So yeah, some people definitely need to take more than that. All right, so Sparky was diagnosed with Graves. Last blood test was December 2024. Lost my job with health insurance, and my methimazole dose was reduced to once every other day, 5 milligrams every other day. Endo quit her job. Oh, wow. Endo quit her job? Wow. I now have hypo symptoms. Can't afford monthly blood test. How much should I reduce methimazole? So again, understand your situation. Keep in mind, I still can't give, I mean, even for my current patients, I don't have prescribing rights. So I don't say, like what I would say in this situation is I would say, go to the endocrinologist and ask to maybe reduce the methimazole to 2.5 milligrams every other day and then do another blood test. That's what I would say. Again, I would never tell someone to just reduce the methimazole, for example, even a patient. So let alone like someone like who's here. So, but again, if I tell someone to go to their prescribing doctor and have them reduce the dose of the medication, in this case to maybe 2.5 milligrams every other day instead of 5 milligrams every other day, I realize some people will do it on their own, but I can't specifically tell people to do that. Um, but I understand the situation. Yeah, sorry you lost your job and that the endocrinologist also, that's strange that she quit. I mean, there are other endocrinologists, but I could understand if you can't afford to see another endocrinologist. But yeah, so that would be my feedback. Okay, and Addie, so Addie says, I'm currently hypothyroid and have an iodine deficiency. However, I cannot tolerate any dose of iodine without irritability, increased hunger, and heart palpitations. Any advice? I mean, I would work on other areas of the body. I would work on improving adrenal health and gut health. And with iodine, again, you got to be careful about iodine, but you need healthy antioxidants like magnesium, selenium, vitamin C can all help. And but some people, even when taking those minerals or nutrients, because vitamin C, of course, is a vitamin, but again, they might still not, they might still have issues with iodine. And so, yeah, I would focus on other areas of the body. And I mean, you want to always, any nutrient deficiency, any mineral deficiency needs to eventually be corrected. But sometimes you have to focus on other things initially. And it sounds like you said you're hypo, yet you're having increased hunger and heart palpitations, which, not to say that can't happen with hyperthyroidism, but I mean hypothyroidism, but just wonder what else. I mean, the iodine deficiency is probably not causing those. So I'm not sure when you got your last thyroid panel and if you had other blood tests, but it sounds like something else might be causing those other symptoms and not the iodine deficiency. All right, let's see. So Mama Boys has another question. I was taking, and she asked a question earlier. So let me just see. Oh, so Hashimoto's turning from hypo to hyper. So you were taking methimazole, 2.5 milligrams, cutting pill in half, and now liver enzymes are up. Can you give me any advice? I'm running out of options, but surgery and radioactive iodine only took it for 4 months. And I think you had something, another like, oh, you were hypo for 14 years. So, um, I mean, methimazole can raise. I mean, the question is, I just released a podcast episode not too long ago about hyperthyroidism itself causing liver dysfunction. So there are a number of things that can cause liver dysfunction, and just so if you're no longer hyper, because you're taking the methimazole, then we could say, okay, maybe the hyperthyroidism isn't responsible. Maybe the methimazole is responsible. So if either the hyperthyroidism or methimazole is responsible, you get like if it's the hyperthyroidism, you of course need to lower the thyroid hormones. If it's the methimazole, that's again, let's say 2.5 milligrams every day, and it's causing the liver enzymes to spike up. I mean, so not everybody could tolerate the anti-thyroid medication. I mean, it depends also on how high the liver enzymes. Like if someone does an ALT and it's like 45, which most labs that would be elevated, but not like crazy elevated. Like if someone's ALT was 120, then they definitely should consult with their endocrinologist about stopping, like switching to something else. Again, I'm not telling anybody to stop, but again, it depends on how high the liver enzyme. So if it's like slightly elevated, like in the 40s, even 50s, it's not like a huge concern. Again, that's obviously we want that to decrease. Like we don't want it to be elevated, but it's one of those risk versus benefits. Some PTU has reputation for being even harsher on the liver enzymes, but not always. Like sometimes people won't be able to tolerate methimazole, but they will be able to tolerate the the PTU. But then again, there are other options like bugleweed, and I talk about all these on my podcast and my book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. I talk about things like bugleweed and L-carnitine, and again, someone mentioned lithium. So the good news, you're on a small dose. So I don't know if that's helping to manage the symptoms, but if you take a 2.5 milligrams of methimazole and it's helping, but if it's elevating the liver enzymes, then maybe then there's a good chance you'll respond to something like bugleweed. And I do have a podcast episode on how much bugleweed should I take if you decide to do that. Or again, you could work with someone, whether it's me or a different practitioner. But again, yeah, I agree. Like surgery, radioactive iodine, I wouldn't like jump into. There's also there's low dose naltrexone, LDN, which modulates immune system and is for some people an option, and then cholestyramine. So if you visit savemythyroid.com, savemythyroid.com/3, that'll take you to episode 3, and that so you could read more or listen more about things like bugleweed and some other options. And then I'm just seeing, because I also have one on conventional options, and I think it's that one that I talk about, the things like cholestyramine and LDN. So I'm just seeing here. Yeah, so it would be savemythyroid.com/2, episode 2, where I talk about, so episodes 2 and 3 you might want to check out. And that's why I create the podcast episodes. It's easier to just direct people to that. I mean, I know people want specific information. I try to give as much specifics without being specific. Like I said, I can't tell people this is what you should do, but I could say, go to the prescribing doctor. Like in this case, also, you could go to the prescribing doctor and like ask to take 2.5 milligrams every other day. But I'm not sure even if the 2.5 milligrams are managing your symptoms. That's the thing. So like if you're 2.5 milligrams, if you're still hyper on 2.5 milligrams a day, then you probably need to speak with your practitioner about switching to something else. All right. So we got a few new people here. So again, like I said, I'll try to get to as many people as I can. Let me take a quick sip of water. All right, so the spell breaker is late to the stream. How much of a tea is okay? Can you be more specific? What do you mean? Like what tea specifically? Like black tea, herbal tea? So if you could let me know what tea you're thinking of. Also, just for those who haven't subscribed to my newsletter, savemythyroid.com/newsletter. It's called Healthy Gut, Healthy Thyroid, released every Sunday. So I've released I forgot 5 or 6 editions so far. So yeah, this Sunday will be the next edition. All right. So Sherry, I had Hashimoto's. Now I have Graves. When making diet and lifestyle changes that could reduce antibodies, how long would it take for the TSI and TPO to show reduction in labs, and would both be the same? I mean, it's everybody's different. I would say at least 3 to 6 months. I mean, some people they notice reductions quickly. Some people they kind of roller coaster up and down, especially more so with TPO antibodies. So they won't necessarily be the same. Sometimes TSI will gradually decrease and TPO will kind of roller coaster up and down. Sometimes we see that with TSI too, but I mean, it could take quite a while. Like with me, it took about 9 months for the TSI to normalize. I didn't have the TPO antibodies, but for some people, it could take longer than that, as long as we're seeing things head in the right direction. But again, sometimes we do see the roller coaster ride back and forth, especially with more so with TPO antibodies. But again, it could happen with TSI as well. So Olga says, is there a concern, please, with having a bit higher leukocytes and our neutrophils? I have Graves, and every blood test, either of those are high, never both. So do you mean like white blood cells? I just want to make sure you don't mean lymphocytes, because those are, I mean, lymphocytes, neutrophils, different types of white blood cell, WBCs. So that's overall white blood cell count. But I guess, I mean, my answer would be, yeah, I would be. I mean, I wouldn't lose sleep over it, but I wouldn't ignore it either. Like if you see the either white blood cell count high or neutrophils high or lymphocytes high, either one, like any of those, yeah, I'm suspecting, is there something going on? Is there some type of infection that's causing those to elevate? So yeah, again, I would say something to look into, and again, maybe further testing. Maybe something might be like if lymphocytes are high, usually it's viral. Neutrophils usually more related to bacteria. Could even sometimes be something like Lyme disease. Again, not saying that's what you have, but could be. Okay, so the spell breaker says, I don't know how much I could drink daily. Motherwort, bugleweed, or the tea. Okay, so I think you're probably referring to lemon balm tea, is what I'm guessing. If it's in my book, I mean, I talk about other teas in the hyperthyroid healing diet, but I think you talk about lemon balm. I mean, if someone's, you don't have to drink lemon balm. I didn't drink lemon balm tea when I dealt with Graves' disease, but if someone drinks it, I would say you could drink. I mean, you could drink a few cups per day if you want. You could. I like when people take lemon balm at night because it has a calming effect. Only thing is, by drinking tea right before going to bed, you might have to wake up a few hours later to use the restroom. But again, other than that, it could be calming. You could also drink a cup or two of lemon balm tea early in the day as well. I mean, the timing doesn't really make a difference. And then as far as how much, yeah, I would say like 2 or 3 cups a day. And yes, okay, you are referring to the lemon balm. Okay, wonderful. All right, so Addie says, I randomly went hyper last year after no thyroid issues at all and then dipped to hypo. Last thyroid panel was recent and numbers were better, but not optimal. Just not sure why I get hyper symptoms when I try even low dose iodine. Yeah, I mean, some people do become more hyper. What iodine's one of those things where it affects everybody differently. In the past, I was more. I'm not against iodine, but I was more gung ho on iodine, where I would supplement with iodine. I would take iodine supplements. I did a urinary test, which showed a deficiency. But then I realized that when I started doing that with my patients, having them test for an iodine deficiency, that yeah, some people it would make them hyper. Sometimes it would aggravate the immune system response, the autoimmune response. Other people would tolerate it fine. So my current approach is not to test everybody for iodine and supplement them with iodine, but is just to honestly initially not worry about testing for iodine and focusing on other things. I know it's confusing because like there's books like iodine, why you need it, why you can't live without it by Dr. David Brownstein, where he says like you need iodine if you have Graves or Hashimoto's. Like that could be a potential cause, but that's not what I've seen. And again, I'm not. There are some practitioners who take the opposite approach, like just Dr. Alan Christensen, like who's been on the podcast, like just have really low amounts of iodine. So I'm kind of somewhere in between, but I'm definitely more cautious now with iodine than I was a number of years ago. All right. What other questions do we have? I think I've answered all questions up until now. And if necessary, I'll go. It's 2:04 now. I'll go. I could go until 2:30 if there are that many questions. If not, that's perfectly fine. And the Spellbreaker says, thank you for all this. Really appreciate all you do and share with us. Yeah, thank you. Again, I enjoy doing this. I feel bad. I didn't realize it was so long since I've been on. I try to do at least one of these per month, sometimes twice per month. And I didn't realize I wasn't on in February. So I feel bad. Just again, been doing a lot, always doing a lot. But again, I try to, like I said, I try to go live and just completely forgot. So, um, yeah, if there's any other questions, and again, if not, we'll call it a Friday. And I think oh, actually, you know what? Let me check. Let me check Instagram. Oh, I don't know if there's any questions on Instagram. Sorry about that. Yeah, Snowy ZC. Hopefully you're still on. I'm not used to going. This is the first time I'm live streaming to Instagram, and like I said, completely forgot that I have to like go. Like it's a bummer with these other platforms that automatically I could see the comments from YouTube, Facebook. But Snowy Z says, is there a preference between the two for resolving issues? I've heard hypo is easier to treat. I'm hyper currently, but I think numbers are slowly coming down and wondering about going hypo. I mean, I will say most endocrinologists prefer they most endocrinologists prefer hypo to hyper, and most other practitioners prefer hypo to hyper. Um, I mean, managing symptoms is, I would say, could be more challenging with hyperthyroidism, but also could be challenging at times with hypothyroidism, Hashimoto's as well. Addressing the autoimmune response, I honestly find, like, for when comparing Graves and Hashimoto's, I think Graves, for whatever reason, I don't have an explanation, but at least with the antibodies for Graves, they seem to, like, TPO antibodies sometimes will drive me crazy. And same thing with thyroglobulin antibodies. A lot of times you'll see them roller coaster back and forth where they're looking good and then they're back high again, and then they're low and then they're high. TSI will do that too with some people, but I see it seems like it's less common. So from that perspective, I guess you could say Graves might be easier, a little bit easier to treat than Hashimoto's, but yeah, like I said, everybody is different. And again, so sorry I missed. I don't know when you asked that question. I just and again, I'm not sure if this person's still on, but and with Instagram, I'm not sure. Like it said something where once it's done, like when I'm done with this, it'll be the recording will appear on Facebook and on YouTube, but apparently on Instagram it doesn't stay on there, I don't think. All right, so Olga says, "Thank you for your answer. I got tested for viruses and CMV, which is cytomegalovirus, Epstein-Barr, and Borrelia, or higher, not in an active state. I took some oregano pills. Anything you would recommend?" Well, for viruses and even for Lyme, I dealt with chronic Lyme disease in 2018, and I always recommend to optimize the immune system. So that's the number one thing I could say. To me, viruses are more immune system problems than virus problems. So uh, in the past, I would recommend antiviral agents and homeopathy. And I'm not saying there's not a time and place for that, but these days, I usually just say, let's work on your adrenals. Let's work on improving your gut health and correcting deficiencies and reducing your toxic burden, because if all we do is give antiviral agents like oregano wouldn't yeah, oregano to me I wouldn't recommend for, usually I recommend for other things oregano, like if someone has SIBO or even parasites, but for Lyme or viruses I'm usually not recommending oregano. But like I said, I would optimize immune system first. That would be number one. All right. Last call for questions because it looks like we're definitely slowing down. So if there are any last questions, let me know. Um, Otherwise, I'm going to sign off, and let me just double check on Instagram if there are any. Same thing with Instagram. Any questions? And again, if I missed, or if again, I don't know if Snowy ZC is still on, but I apologize about your if you're not on there, because again, you might have asked the question like a while ago. But yeah, so no Instagram questions. Let me just make sure there are no other questions on YouTube or Facebook. Yeah, it looks like that's it. So I mean, I will call it a day. And again, hopefully I'll be able to get on again sometime this month. We'll see. Again, just like I said, it's been chaotic. I'm not saying that in a bad way. I like when it's busy, but I also like to hop on every now and then. I also did have a live boot camp in January, so I know I answered a lot of questions, and that was a free boot camp I did. So and then yeah, so but anyway, thank you everyone. Thanks for tuning in. Thanks for your questions. Hope everybody has a great rest of your Friday, a great weekend ahead. And again, one more, I'll pitch my newsletter one more time just because it's new. Healthy Gut, Healthy Thyroid. Visit savemythyroid.com/newsletter. And of course, you can see the other resources, my books, my podcast, which is on the previous slide, Save My Thyroid. And again, thank you so much, and everyone take care.